there. I'm just having a look to see what you've been doing to yourself. Okay. So you've got a foreign object lodged up your left nostril. Yeah, okay. That's not good, is it? Do you know what the object is? Okay. Right. I'm going to see what I can do for you today, since you've been rushed in here. How did this object get up your nostril? You were sleeping and your niece pushed it up your nose. I'm surprised that didn't wake you up. I think it would have woken me up. Anyway, I need to have a good look first. Okay. This might be rather uncomfortable, okay, if you've got something up your nose at the moment. Let's just do a little wipe there. Okay. Let's just get that little wipe off where that's been bleeding. Okay. Alright. Okay. So what I'm going to have to do is going to pop this otoscope up your nostril. I'm going to have a look at both nostrils, okay, just to make sure there's nothing up the other one as well, although I'm sure you know if there was. Okay, I do apologise because as I lift the tip of your nose, this is going to make the side where you've got the foreign object lodged pretty uncomfortable. Okay, so take some nice deep breaths for me. Yeah, okay. Alright, keep very, very still for me. So let's just have a look up there. Oh, yeah, I can see it. Okay. Let's have a look up this side. Okay. Alright. Yeah, okay. So your right nostril is clear, but you do have this piece of stone or gravel lodged up this nostril, as you said. Okay, so let's just have a look here. So you've got no allergies to local anaesthesia, no lidocaine allergies. That's good, because that's what I'm going to be using. Okay, I am going to have to try and numb the nostril to remove this, okay? And then afterwards, I'm going to have to cauterise the area, I think, because it's got some damage and that could keep bleeding. Alright, but you won't feel that because I'll apply some more lidocaine. Okay. So have you got any headache or anything like that at the moment? Okay, how's your vision? Vision's good, okay. Let me just have a little press around your face. I can't see any other signs of swelling or anything around there, which is good. How long has this object been up your nose? A few hours. Oh, okay. Alright, let's just have a look around that area there. Okay. It's important that I check that there's no inflammation. Alright. Okay. I'm just going to take another quick peek up this side. Alright, just there. Okay. Keep nice and still for me. Nice and still. I'm just going to have another look up there. firstly, I'm going to use some lidocaine on some cotton wool, and I'm going to have to insert that into your nostril. Now, as your nostril is already feeling very blocked and sore, I do apologise, but the cotton wool is going to have to stay in the nostril. I'm just doing this to try and make the insertion of the instruments to remove the foreign object more tolerable for you. Obviously, as you're not being put to sleep. Okay, let's have a look at that now. So let me just pop some of that on there. Okay. Alright. Might need a little more on there. Okay. Let's just pop a little more on. Alright. Okay. So this might feel a little bit cool. Sting temporarily, then it will go numb. Okay, so again, if you just pop your head right back for me. Okay, that's great. And I'm just going to insert this into the nostril now. Okay, there we go. There we go. Okay, I'm sorry that's uncomfortable. Okay, so another look there. Another little look up. Nice and still for me. Nice and still. Yeah, okay. I just got to leave that a few moments while that takes effect. Okay. How's that feeling? Okay. It will take a little while. Okay, now I've got this special mirror. I'm just going to pop that there and just look up. Just look up the nostril. Okay, just to have a nice close look at how that's doing. Yeah, okay. Just checking the other side too. Okay. Alright. So I'm just going to remove the cotton wool and just check that that's feeling numb. Okay, keep your head nice and still for me. Alright, let's just up there and pull that out. There we go. Let's pop that there. Okay, now if this feels painful in any way, just let me know. Okay. Can you feel that? A little bit? Okay. Not a problem. I'll pop a bit more lidocaine in. Some people are a little bit more resistant to it than others, which is fine. Alright. And back again, just up there. You're doing really well. Okay. There we go. I'm going to leave that for another couple of minutes. Okay. Right, let's get everything assembled. Because I want to get this removed for you as quickly as possible. Let's just do you a little gauze dab there. Okay. just going to remove that and we'll take another look. Okay, there we go, gently. Right, tell me if you can feel this now, okay? No? Okay, that's great. Alrighty, so I'm about ready to remove the object, so I want you to just stay really nice and relaxed. It's imperative that you stay absolutely still, okay, because we don't want to get this any further up, okay, because it's situated about here, alright? It's rather high up. I don't even know how it's got that high up, so obviously there is going to be a little bit of damage when I pull it down. It's probably going to scrape. It looks like quite a sharp piece of stone. Alright, so expect a little bit of bleeding there, but as I said, I will cauterise that afterwards for you. Okay, so take some nice deep breaths with me. So in and out and in and out. Just do that a few times. Okay, right, let's get to work on removing that. Okay, good. Right, he's going to take a steady hand, which fortunately for you I have, okay. Alright, so I'm going to clamp the nostril open a little bit and start to insert. Okay, I'm sorry if that's uncomfortable. Obviously I could only numb the lower portion of your nostril because I can't get any higher up because of this. Oh, that's quite stuck, isn't it? Just keep breathing for me. Keep breathing. That's brilliant. Okay. Just need to wipe around there a little bit. Okay, just a little wipe around. Okay. You're doing all right there. Well done. I know this is really unpleasant. Okay. All right. Keep very still for me. I think I've got a grip on it now. I think. Yeah. Okay. Nice and still for me. Just opening up a little bit there. Okay. Right. I'm starting to move the stone down now. Okay. Alright. Very, very gently. You okay there? Alright. And deep breath for me. Okay, great. There we go. Let's quickly put that gauze there. And there it is. Can you see it? Piece of stone. That's what's up your nostril. It's huge and it's very sharp too. Very, very sharp. Right, let's pop that there. I'm just going to pop some cotton wool in there a second. There we go. Okay. I shall put this into a little pot for you to take away as a souvenir if you wish. Okay. very sharp. So I'm going to have to just remove this cotton wool. Okay. And take a look up now and see what we're dealing with, if I can see clearly. Okay, I'm just going to use the mirror for this time. Okay. Alright. Okay. Nice deep breaths for me again. That's super, you're doing great. Okay. Alright. Oh, okay. Yeah. It doesn't look like there's anything else up there, so that's really good. That's really good. Checking that mirror. Okay. So what I'm going to do now is cauterise the area. This will stop any bleeding and it will also help the area heal over. It might take a couple of weeks or so to do the healing process. Now in that time, I will warn you, you're going to get a lot of itchy, tickly sensations in your nostril. Like you want to sneeze, try not to sneeze if possible, because that can dislodge the actual tissue that's healing. Okay, and it can cause it to open up again. Alright, it's very difficult because it does start to tickle as it's healing. Okay, please don't touch it, please don't blow your nose, okay? And, you know, try and keep fingers away from this side, any pressure on this side as well. Okay. Alright, just bear with me while I get ready for that, because I'm going to have to put some numbing further up your nostril to do that. Okay. Alright. So I'm going to use some more lidocaine, but this time it's going to be higher up the nostril. Okay. There we go. A little bit more. Want it well soaked. All right, just pop your head back in a little bit there. There we go. And that's just going right back up, but a little bit further up this time. Okay. Doing great, thank you. Okay, there we go. So how the cauterisation works is I use one of these silver nitrate sticks. It's inserted into the nostril and I rub it around like so, and then that causes a reaction in the nostril and it starts the healing process of the skin, almost like forms a kind of scab up your nose. Okay, so that's how that works. Okay. And you won't feel any of this because the local anaesthesia will be working. Okay, let's just quickly update something here while that's taking effect. Okay. Is it tickling a little bit? Yeah. It'll be numb very, very soon. Okay. Alright. Okay, let's just remove that cotton wool now. Alright, 1, 2, 3. There we go. Got that out. Right, head nice and still. Just tell me if you can feel this here. No. Up there. Okay. That's good. Right, so and just check that's all good. Looks fine to me. couple there just in case I need them, but I don't think I do. Right, okay, so I'm just going to hold your nostril open, again, and then I'm going to insert this up and move it around. Okay, nice and still for me, again, that's great. Okay, going up now, and twisting it around. Is that okay? Good. Okay, just removing that now. Okay. Nice look at your nose. Let's just get the mirror again. Okay. And let's just have another look up there now to see what's going on. Hopefully it's looking a lot better. Okay. Nice deep breaths for me. Okay. Just looking in the mirror. Yeah. That's looking really, really good. That's looking really, really good now. You can't feel anything now, can you? No. That's good, that's good, that's good. Okay, just check around the other nostril while we're here, just to make sure. But that's looking absolutely fine as well. Absolutely fine. Okay. Just going to have one last wipe around underneath there. Okay. Get you cleaned up. How are you feeling at the moment? Not feeling dizzy or anything? No, that's good. That's good. You've done absolutely wonderfully. Okay. So let me just have a little final press around to make sure that we're still all good around your face, that there's no reactions there at all. That's looking really good. Well done. Okay. I'm just going to press down your nose, okay, very gently down your nose like that. Okay, and again, very gently down your nose. Okay. Alright. Well, that's all been a success. And there's very little damage up your nose. It's just got some little lesions in one area where the stone was scratching the nasal wall, the nasal lining. Okay. So you can go on your merry way with this. Your stone as your souvenir. I perhaps suggest that your niece doesn't do this again in future. It's really dangerous. And I can't even understand how she got it up there, to be honest. There you go, you can have that. Alright, so we put that there. Now we're just going to send you back to the little ward area where you were before. We'll get you a nice cup of tea and a biscuit just to make sure you're feeling okay. We'll make sure you've got pain relief because it may feel a little bit sore later when the anaesthesia wears off. You may find you get a little bit of a headache as well. So the nurses on the ward will sort you out with that and the doctor will write a prescription. Yeah. Okay. So if you're happy, I'll get the nurse to come and collect you. Yeah. And hopefully I won't be seeing you again for the same thing. Alright. You take care.